So we're going to start. I have a lot to share with you. I am an adjunct clinical associate professor at NYU, and I'm excited about, I've stayed associated with the university for a number of reasons. The first is, I think we have to get the dental students and medical students and students of, this is where we start to create a paradigm shift and getting them to embrace the kinds of things that I'm talking about, because really, traditionally, oral health has been the 800-pound gorilla in the wellness room. I can't tell you how many patients have come to me after, 6 years of seeing their general practice, PCP, primary care provider, for Lyme disease that they came up positive on, and they're not getting better. And then they've gone to a functional medicine doctor that is trying to fix their gut for 3 years or 4 years or 5 years. And then they are kind of evolving to where, I have to go to someone out of the box. Then they go to that person out of the box, and it's like, you need a dentist to clean up your mouth. So then they look for their regular dentist. I had a woman this past week, 32 amalgam fillings placed and removed, 32 amalgam fillings, and she has blindness in her her right eye. She has Meniere's disease. She has, I can tell Dick down there, he's right on the same page with me in the world of dentistry, where the unsafe removal of an amalgam filling, a mercury filling, is as bad as placing it in the first place. So the first person that really got to plug dentistry, which was unplugged from medicine, was, and that's my Bitmoji, by the way. The first person was Thomas Rao 25 years ago. I had patients. I had an RN who had breast cancer who went to him. She came back healed. The first thing he told her is, get out those 2 root canals, get out those 2 mercury fillings safely, and get through the That was 25 years ago. And I was like, who is this guy? That he's looking in the mouth before he would touch you. Before he would even touch you, he looked in the mouth. And I thought that was just, wow. Dentists were always the ones, who practiced out of the garage of their house that they converted to an office, right? And they, we were drill 'em, fill 'em, and bill 'em. Well, I came out of dental school in 1983, and I hated the idea that I was going to be a mechanic of teeth. I hated it. And I went into a master's program in holistic health, the first one in the United States. Dr. Alan Pressman in New York, probably the first functional medicine doctor, chiropractor, started a program, a certified master's program in holistic health. And I learned things that I can't, it started to radically change my life, even though I wasn't, out of the closet as a biologic dentist, as I like to say. I was still in the closet. And I came out about 10 years after I was mercury toxic, by the way. I wrote this book in 2016. There's a new book coming with a whole new cover. It's a very dated cover, but it's a good book. I wrote the book to help, really, for patients. It's written in a very friendly way that makes it easy to understand. I explain the oral microbiome. I explain the mouth as a mirror and a gateway. But the first guy to do that was this guy. And this was Weston Price, who was a dentist and an anthropologist. And he was lecturing in 1917 on the present state of our knowledge of the relation of mouth infection to systemic disease. And he was scoffed at, the idea that what's going on in the mouth can affect the rest of the body. He was scoffed at. So now we know a lot more. Thousands of studies linking what's going on in the mouth to heart disease, respiratory problems, diabetes, rheumatoid arthritis. And we know the mouth has a mirror for everything from diabetes to AIDS, leukemia, vitamin deficiencies. I can go on. I'm preaching to the choir here in terms of looking at the mouth as a diagnostic tool, looking at the tongue in Chinese medicine and Ayurvedic medicine. But the mouth has a gateway, and this is my favorite slide. You could take a picture of this one. So here's the oral microbiome, right? 6 to 10 billion bacteria in the mouth. Well, it's linked to inflammation-induced carcinogenesis. Yep, deregulating your immune system. The oral microbiome helps to regulate and stratify your immune system. Creates an activated inflammatory response. That's where we're looking a lot. The idea that chronic low-grade inflammation, which is what gum disease is, can dysregulate your immune system and create a pro-inflammatory genotype. So I put down the top 10 sources of chronic inflammation and toxicity in the mouth, and I actually have these for you. I created a brochure if you're British, but I created this informational booklet on the top 10 sources of chronic inflammation and toxicity, so you can have it there. We're going to talk about these. And I also created another one for a talk I'm going to do after the break on cavitation. Specifically, James and Jane asked me to do a short presentation on jaw cavitations, what they are, why they're significant, how we treat them effectively. So let's talk about periodontal disease. Time magazine in 2006 called gum disease one of the body's primary sources of chronic low-grade inflammation. Primary. This is a book I read when I did Harvard Medical School's program in complementary and alternative medicine, which was a short run, unfortunately. Dr. David Eisenberg up at Deaconess Hospital did a Harvard Medical School program on complementary and alternative CAM, what it was called back then. And I was the only dentist there. And they were all like, "What are you doing here? What are you doing?" So I was like, "I don't know. I got led here." So, how does this happen? How do we go from healthy teeth and gums to advanced gum disease and then all of this? Huge connection with Alzheimer's, by the way. Atherosclerosis, this is where probably 1,000 studies have been done on gum disease and heart disease, and diabetes. So gum disease makes it harder for your body to regulate blood sugar, but it also sets you up for actually developing type 2 diabetes as well. So it's bidirectional. So again, this one woke me up. Well, you have gum disease, you're 3 times more likely to be impotent if you're a man. Pregnancy complications, 700% higher incidence of premature low-weight babies or preeclampsia, very dangerous blood pressure condition, lots of stuff. But this is the one that really woke me up. The idea of chronic inflammation as a link between periodontal disease and cancer, gum disease and cancer. Yep. So, and a lot of it has to do, and this is 2015, gum disease deemed a catalyst for cancer cell growth. So a lot of interest in this area. Now, what's the problem here? The problem is 80% of you have gum disease. 80%. We were talking about how we are in a historic time in the history of humanity, right? Staying healthy is like walking through a minefield. And we have to empower ourselves in mind, body, and spirit. That's why I love this group, because this is really a mind, body, spirit group. We recognize and respect the 5 phases and the 5 planes of healing, going from biologic to spiritual, and how they all connect. So the link to gum disease is well established. And the third one is my mission in life. One of my 2 missions is to change how people take care of their mouths. Because, and the second one is to merge dentistry back to medicine, where it belongs. Thank you. And the third one, and I was talking to Christine about this, and we were talking last night, and a lot of people that I spoke to is that my real mission now is to teach and to really educate the next generation. And that's why I was excited about NYU, because I got asked by the dean of the college to actually take one of the 6 clinics. And this is unheard of, because Dick Tom, who's all the way over there on the left, was a dentist, and he was crucified, and mentally and emotionally, not physically, but for standing up against dental mercury, for standing up against a lot of the things that were being done that are an embarrassment to the profession of dentistry. Dentistry has done a lot of good things. We actually invented anesthesia, which makes operations a lot more pleasant. And we invented the idea that prevention is important. Dental hygiene started. Dentistry was the first profession for taking a preventative approach. So we're going to change past approaches. And gum disease is very expensive. Very expensive. But you know what? There were 2 studies done, one at Columbia University Medical Center in New York on 146,000 people, and it was repeated in Japan. And they found that improving oral health, just treating the gum disease, reduced healthcare costs for the 3 most expensive systemic diseases: cardiovascular disease, diabetes, cerebral vascular disease. The reduction in healthcare costs for diabetes was 23%. The reduction for cardiovascular disease was 21%. The reduction for cerebral vascular disorders was 19%. Does anyone know how much money that is in healthcare savings? Just in the United States. Keep going. Think hundreds of billions. $750 billion. $710 billion. You want to make universal health care affordable? Let's plug dentistry back into medicine. So how does this happen? How does this happen here? We go from this to this, which we could put on your door for Halloween. This, and I see a lot of people like this. By the way, I just came back from speaking at the 14th European Congress of Integrative Medicine in Porto, Portugal. 700 practitioners there. A lot of them had terrible mouths. And I kept going, God, I can make a fortune here. No, I didn't say that. I didn't say that. I did say that in England, though, at a wedding once. Anyway, so this is where it's at, everyone. I spent 23 years now, since 2000. No, 20. It'll be 21 years that I have been researching the oral microbiome, mentored by someone who Colgate and Procter & Gamble gave millions of dollars to study how to kill plaque. His name is Dr. Stephen Moss. He's an MD, DDS, PhD. Pretty smart guy. And he had a company called Health Education Enterprises. And so companies would give him money. He sat on the board, the medical board of Colgate. He sat on the medical board of Wrigley's Gum. So whenever Colgate wanted to come out with a new product, which they were working on at the time, called Colgate Total with triclosan copolymer, previously banned by the FDA, now being allowed again at a lower level. And it nuked. It is a non-biodegradable pesticide. There is a study that came out from China that brushing with triclosan, if you have chlorinated tap water, creates chloroform molecules. And it is an endocrine disruptor, and it was linked to cancer. But that's what they were trying to do. So the whole approach in oral care has always been kill it. Oops, I don't want to trip over this. Kill it. And when you kill it, you create this desert over here. And we do that every time you brush with a detergent toothpaste. You know, toothpaste was invented by soap makers, right, 150 years ago? They were soap makers. That's the development of toothpaste. It was flavored detergent for your mouth. And then in the 1970s, we started doing microscopic looking. Oh, there are these bacteria. Oh, we got to kill them. If we were successful in killing plaque, we would have unleashed ecological Armageddon. So what do we do instead? We keep trying to kill it, but the bacteria have paid a much bigger price to be there than we did. They were around before we were. Okay? Really there a long time. And as a matter of fact, there's a lot of bacterial mitochondrial theories of evolution, of creation. Even if whether you're a creationist or an evolutionist. Genesis chapter 2, verse 7 or 8, when it said, God took from the dust of the earth and breathed his spirit into it and made man. I was like, why would he take that dust? That was like on the bookshelves that my mother used to clean in the den, the dust. Well, the word in the ancient Aramaic and Hebrew is not dust. It's slime. God took from the slime of the earth. The earth was covered with microbial slime. Scientists agree. Microbial slime. Why does a bacterium look like a mitochondrium? Could it be that the mitochondrium was a bacterium in origin, got engulfed in a cytoplasm, organized into cells? There's all this intelligence, the intelligence of the bacteria. And right now, sitting here right now, the bacteria and the microbes outnumber us by 10 to 1 in our body, on average. I don't think anybody's got the full count. But let's just say there's a lot more of them than us. And so I had a couple of microbiome commandments. You could take a picture of this. Humans are made of microbes. We're made of microbes. Microbes control us. We don't control them. If you go to war with your microbes, you're going to lose. There's a lot of people sitting in hospitals that are antibiotic resistant because they behave like us. Microbes are a microcosm of who we are. I think it holds the cosmic intelligence of our ability to self-regulate and heal. And we have been trying to kill them for a long time. And we don't understand. Even when I came into biologic dentistry, I went to the first IAOMT meeting. They heard me on Dr. Oz talking about toxic fillings. They were trying to get the word out about mercury. And fortunately, because I have a good voice, I got on Dr. Oz and talked about toxic fillings, went all over the place with it, and the IAOMT made me their keynote speaker. And when I was there, all they were doing was talking about killing ozone. Put the ozone trays in the patient's mouth. Everybody put your ozone, get your ozone on. I love ozone, but ozone has to be used responsibly, like alcohol and tobacco. No, I'm kidding. So to stay healthy, what do? Make peace with your microbes. Amen. So when we look at the route of so we have probiotics and conbiotics. What do we call conbiotics? We call them pathogens, conbiotics. And there's a reason why probiotics don't work in the mouth. I see so much junk in the natural oral care space that I want to pull my hair out. Thank God I have enough that I could keep pulling. But there is so much junk in the oral care space with no science. Charcoal toothpaste. Xylitol kills bugs. Let's use xylitol. Anybody know where xylitol came from? DuPont. Okay? Subsidiary Danisca found a way, brilliant, to make a multi-billion-dollar sugar alternative from GMO corn cobs that they were throwing away. Take Xylan from GMO corn cobs, put them in an industrialized process using rainy nickel as a catalyst, and you end up with what the organic chemistry textbooks call a high-value chemical. It's not natural sweetener. Sorry for my New York accent. So you're either going in the digestive tract. Now, we used to believe that the digestive tract The hydrochloric acid of the stomach knocks off those bacteria. Au contraire, these bacteria, besides the fact that how many people have GERD in the United States and are on protonics to reduce their stomach acid? Besides that, they took plaque off the tusk of a mastodon, frozen in a glacier for thousands of years. They put it on a petri dish at body temperature, and they saw these little round things start to unfold and flourish like seeds in a farm. Excuse me, in a garden. It was like Jack and the Beanstalk. Because what they found is, under harsh conditions, these bacteria have the capacity, they're called persister bacteria, and they secrete a protein shell. They wall themselves off. So if you go to war with your microbes, you're going to lose. We need to understand this intelligence. The oral microbiome in your mouth is now being thought of as another organ system. And then we know in the bloodstream, right? Bleeding gums, boom, 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 right in there. They've taken porphyromonas gingivalis from the mouth out of plaques and arteries around the heart. So the interaction between the oral microbiome and the gut, whoa, big one. Big one, big one, big one. The progression of oral bacteria in the gut, porphyromonas gingivalis, one of my favorites, Fusobacterium nucleatum. This is a big, badass bug, okay, that is benign in a balanced environment. And Klebsiella pneumonia, which has been linked to ulcerative colitis and Crohn's, all from the mouth. Crohn's. So you can't fix their gut unless you fix their mouth. And one of the greatest compliments I got was Dr. Thomas Rao sitting next to my wife 2 weeks ago and said, "Tell Jerry that was a fantastic presentation." And she said, Thomas said, he said to tell you, it was good. And I said, yeah. And he said he really loves the toothpaste. He wants to carry it, but he wants to put his picture on it. Okay. So Fusobacterium nucleatum. Commensal bug turn path. Commensal community bug. One of the most popular in the mouth. What happens when you piss it off? Pardon my New York speak. Pregnancy disorders, GI disorders, inflammatory bowel disease, cardiovascular disease, rheumatoid arthritis, respiratory tract infections, Lemierre's syndrome. I'm seeing a ton of that now with patients coming into me. Alzheimer's disease. On and on and on and on. And this is the most common bug in the mouth. Should we kill it? Should we kill it? Or should we promote microbial homeostasis? Peace, love, gratitude. Okay? Let's do it again. When I was on the Martha Stewart show, I was doing research before Revitin was even developed. I was on the Martha Stewart show in 2008. She said, "I know you're doing a lot of research in oral care." I said, "Yes, Martha." I said, toothpaste was invented by soap makers. When I was a little boy, if I said something dirty, my mother said she'd stick soap in my mouth, but I was brushing with it, And then I said, and then we had this idea to put bug killers in. And you know what, Martha? I think it's time for doctors to get out of the pesticide business. And what I'm promoting is organic gardening for the mouth, because that's what this is. Thank you. So the factors affecting dysbiosis, we're going to talk about some of these now. I got to step it up a little bit. But we have diet and nutrition, which that's got a lot about that. And there's a lot of really smart people here in that area. Toxicity and endotoxin productions, we're going to talk about this. We're going to talk about sleep and airway health and upper airway resistance and how we treat it non-surgically. And then my favorite, harmful oral care products. I mean, I just think there's my hope and my dream for Revitin is that it will create a paradigm shift in oral care. This is a pro-microbiome, prebiotic, not probiotic, prebiotic approach to nourish and support and balance the natural ecology of your mouth. Because when we do that, I can't tell you how many good things happen. Exercise. Today, I got an email this morning from a company called Cosmos ID that does microbiome testing on how exercise creates a healthy microbiome, a robust, diverse, healthy microbiome, and the production of short-chain fatty acids, which are anti-inflammatory. So let's talk about some nutrition. Saturated fatty acids, vitamin C, B vitamins, vitamin E. Here's your palate. All the things I love. These are all in my book. And the diet and the oral microbiota go hand in hand. Exercise. I had this in my presentation before that email this morning. Just saying. And microbes produce substances called, right? There are certain microbes that produce substances called short-chain fatty acids, and pardon me, Moira, it's an Italian bacteria. It's called fecali bacteria fusati or something like that. It sounds Italian. But the fecali bacteria prusinati, anybody hear that? He lives down the block next to Salmonella. Okay, now. Stress. Stress does the same thing. You cannot have a healthy microbiome if you're under stress. So when you're under stress, so I have 4 pillars in my book. By the way, I have books there. I'm happy to sign them. I'm happy for you to take a copy. Deborah Hader was kind enough to bring a case of books, and so we have books to sign. We'll do a book signing maybe at the end of the day, after a few cocktails or after this or whatever. But in there I talk about stress and the importance of stress for a healthy mouth. Stress, management of stress for a healthy mouth. Healthy exercise, not, X Games where you're really stressing your body to the max. So stress in the gut-brain axis, really interesting. The idea that the bacteria have this coordination with the vagus nerve, gut hormone signaling, and of course, tryptophan metabolism and microbial metabolites. Who makes the short-chain fatty acids that reduce inflammation? Microbial metabolites do. Your bacteria. Your bacteria produce short-chain fatty acids. So we're going to touch this. This is what I'm going to be talking to you about, the presentation after this. And, yep, this is a hole. Dentists see this, and they go, oh, yeah, the bone looks a little irregular. No. That's what it looks like when you uncover it. Okay, so we have a lot. I created a protocol, and actually what I'm trying to do right now is get the best guys in the country that have hands to do this type of surgery following the same protocol. It's really important because it's like the Wild West in the biologic dentistry world, and we're going to change that. Now, I apologize because a lot of you have worked with biologic dentists who all of a sudden are like, yeah, I'm going to call myself biologic. I'm going to join the IOMT, and now I'm a biologic dentist. They have had no certification, no clinical training. They just decide to read a little bit and join a club. So that does not work. Amalgams. Ay. Amalgams. Yep, that's a good one for Halloween, actually. So this is, amalgam is 52% elemental mercury, 26% silver. If your dentist says, Susie, I'm going to put a little silver filling in the back, doesn't show, stay in there for your whole life, he's lying. That's fraudulent misrepresentation. He could say, I'm putting a silver color. Oh, but what's it made of, doctor? Oh, it's 52% mercury, 26% silver. So either he calls it an amalgam or he calls it a mercury filling. And by the way, if OSHA came in a dental office when this stuff is being removed, by the way, here's the World Health Organization statistic on mercury toxicity on the earth. That's the part of the pie that comes from dental offices. That's fish and seafood, air and water. They don't have coal-fired power plants. So it's a dynamic duo of neurodegeneration, right? You have toxicity and inflammation. So it readily passes through your cell membranes. I know a lot of you deal with this all the time. By the way, you do a blood test to see if you have high mercury. I just had a blood test. This is not high mercury. Well, it doesn't stay in your blood, sweetie. It goes right past the blood-brain barrier. It penetrates tissues all over, in your gut and everywhere. So there's 2 S's for how to get mercury out of your body. Slow and steady. Yes, Dick? Slow and steady. So your brain's a primary target for heavy metals. We know this. So, by the way, I don't know if I have the slide in here. Does inorganic mercury play a role in Alzheimer's disease? I don't even have to read the study. Okay, the answer is yes. By the way, the symptoms of mercury toxicity and the symptoms of Alzheimer's disease, line for line, are the same. This was a documentary. A friend of mine, Randall, did this. I was a producer on this film. You can get it online. Everyone should see this. Dick, have you seen this? Evidence of Harm. You can go to Amazon, Evidence of Harm, or you can go on YouTube. But just Evidence of Harm is a whole documentary on the use of dental mercury in the United States and the insanity, the congressional hearings that were done. So, by the way, everybody, good news. The FDA has banned dental amalgam for pregnant women and children. They banned the use of it. The rest of us could go to hell. Pregnancy and children. I mean, like, really? Pregnant women and children? Well, that's unconscionable anyway. Stick an amalgam in a pregnant woman? Or a child? Oh, so the woman who was blind in the this was really touching. We had a very powerful consult. I do a lot of Zoom consults. I do sometimes 8 a day. And I can read the cone beam on that. I could look at their records on that. I could advise them on that. I can give them second opinions on that. It's really great. So telemedicine, one good thing that came out of the shutdown is people readily accept it now. And they're like, I don't want to go into New York. I don't want to go to the Hamptons either. I want to just talk to you on Zoom. And so we do a lot of that. And this woman, by the way, she had a whole meltdown. I started and she was an evidential medium with 100,000 followers on Instagram. Evidential medium. She reads people and she feels ashamed that she's so sick. And I said, you know what? The great thing about biologic medicine, the great thing about bioregulatory medicine, excuse me, James, is bioregulatory medicine recognizes our divine capacity to self-regulate and heal. That we have this life force that gives us this amazing ability for self-regulation, recovery, renewal, health, rebirth, right? And at 5 levels, boom, 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 boom. And what I told her is, you're stuck on the 4th level, psycho-emotional. You're sick and tired of being sick and tired, and you don't believe you're going to get better. And you have a lot of guilt because your son was born with autism and high mercury levels. Because you had 32 amalgams done in your mouth before he was born. And because the guy, your father, who was head of the country club, didn't let the guy in to join the country club, so he got back, and that was her theory, why she had 32 amalgams. But I was like, how do you end up with 30? I've never heard of that, 32 amalgams. So yeah, so she's dealing with a lot of stuff, but we can self-regulate and heal. So let's talk about other sources of metals. Other sources of metals. Anybody have any of these? Little porcelain crowns on a metal thimble. Anybody have those? So, this metal, okay, you got porcelain on the outside. Then you wear through the porcelain. There's lead. There is chromium, cobalt, nickel, cobalt. They're loaded with nickel. So the elemental, the alloy used in the crowns was a nickel chromium base metal. So you got nickel, a carcinogen. So have your dentist look at metals. By the way, a lot of times these crowns are done on top of old amalgams. So you have the mercury filling with PFM, porcelain fused to metal crown, on top of it. So when we look at this, was a study done with zebrafish, and just demonstrating the toxicity, the biologic toxicity of this. So I routinely treat this as if it's mercury. I'm like, you really want to be metal clean? That's what we're dealing with. And the next one, titanium. Wow, do we have a giant problem on our hands, everybody? Because we got a multi-billion-dollar dental implant industry that is built on these cylinders. So you know how this came about? Does anybody know the history of this? Per Ingvar Vranemark in Sweden, hematologist, put these titanium cylinders in the femurs of calves. He was doing bone marrow studies. And then when he went to try and get them out, he was like, oh my gosh, the bone grew around the metal. This is unbelievable. The body loves this stuff. So then that became, they were going in like this, and then it became like, oh, let's make little cylinders. Because prior to this, it was even more barbaric. There was something called blade implants, where you hammered these metal blades in the jaw. I mean, it's really crazy stuff in the history of in the dental implant world. So now, how many people, anybody have a hip replacement, shoulder replacement, Titanium is inflammatory. The only good thing is, in the hip, you don't have saliva, because saliva acts like battery acid. So especially if you have an acidic mouth, you have a weak electrolyte now causing corrosion, and this is what these look like. We start to see all of this rejection. So the reason the bone grew around really fast is because these were inflammatory. And I had three of these. I have one left to come out. I had 3 dental implants from old root canals that were removed. And what we find now is that these will fail. So the bone that grows around it is called sclerotic bone. There isn't a good blood supply. It's kind of the body trying to wall off the implant. And then you get this, complete destruction of the bone. Look at the condition of the gums. I mean, some of it even looks purple. The gums turn purple and all this stuff. We see this routinely. It's just a matter of time. So the good news is that, this is more bad news. I'm sorry. This is a study. This is a study from 2021. Very interesting about what happens after implant placement and how there is a corrosion of the metal implant that distributes these titanium from the titanium oxide layers, and titanium particles get distributed in the lungs, the liver, and the kidneys. They have found them in all 3 of these. And the reason is these 2 things here: chemical corrosion and surface wear, and then saliva I was talking about as a weak electrolyte. So this is the causes of the release. So you have these things. Fluoride is really great with it. That's a real nice molecule. You could probably start your car, fluoride, the implant, and you have a nice battery going there. So zirconia is here. We do more zirconia implants than probably any dental office in the country. And the reason we do is because we actually, several of the people on my team have been working with the bioengineers in Switzerland, because most of these come from Switzerland. And by the way, all the major implant companies, Straumann, Nobel, all these multi-billion-dollar publicly traded companies are secretly, silently introducing zirconia alternatives while they're pushing their other stuff still. So they're pushing the other stuff, but they're introducing zirconia. What are the advantages of zirconia? Okay, so this is the metal implant. This is what zirconia looks like. Zirconia does not block meridians. It doesn't corrode. It doesn't corrode. The soft tissue likes it. The type of bone that grows around zirconia is called cortical bone. It is not sclerotic bone. It is vascular. It is vascular bone, which means it has a blood supply. The lifeblood of your mouth, of your teeth, is saliva. The lifeblood of your bone is blood. That's really where it's at. And you want a blood supply around this. Okay, so what are the advantages and what are the disadvantages? The advantages are this is the only biologic alternative for tooth replacement. I believe in our lifetimes we'll probably see stem cells emerge more, but right now it's probably a decade away before they can get stem cells implanted that would differentiate into some kind of tooth. But we're watching it. The Italians have done a lot of work with it. The Israelis have done a lot of work with stem cells growing teeth. You may, if you Google stem cells grow teeth, yeah, they grow like a nub or something, you know. And gum regeneration. The Italians did a lot of work with periodontal regeneration, regenerating gum tissue, and it's being used to regenerate pulps as an alternative to root canal therapy. So we are moving in the right direction. It's just important to understand that zirconia is the only alternative we have right now for people that want permanent teeth and need permanent teeth. And it takes long. Here are the disadvantages. Oh, by the way, this doesn't block meridians. This, I forgot to add to the great news. This will act like an antenna for 5G in your mouth. So do not hold your phone against your ear if you have metal dental implants in your mouth. That was a study from Germany on implants actually heating up in the human jaw. So this has been the evolution from the 80s, the 90s, and here we are, 2000 plus. I've been using these for 10 years. And we have some really nice. Here are the two things. They're very difficult to place. You have to wait 6 months, not 3 months, to put a tooth on top of it. Usually, you could do some. Now we're working around with some bioenergetics and things like that, where we can immediate load and do these kinds of cool things. But they're also very difficult to restore. So we have actually, in our office in New York, have created special attachments, and my ceramist, Roberto Rossi, does magnificent work in creating a beautiful ceramic crown with a ceramic post and a ceramic implant. And we're working with two-piece implants, and these get placed at the level of the bone, so the gums are on top, so the aesthetics are beautiful. I could show you cases where you cannot tell a patient has an implant from a natural tooth. Metal implants, they corrode, and eventually you get this black and this dark color around them, so they're not great. These are the advantages. I didn't have to tell you. High biocompatibility, more hygienic, superior gum tissue. They don't conduct an electric charge. They do not corrode. They're more attractive. Lower incidence risk of infection. Endodontically treated teeth, this is another pariah in the dental world. We used to think that we can embalm these teeth, and it's the only procedure we do in medicine where we keep something dead inside you. Okay? We don't do root canals on gallbladders and appendixes and femurs and whatever, But for some reason we thought, here's an abscess, right? Active abscess. This now become a cyst, and you do a root canal. That cyst ain't going anywhere. Because what is a cyst? A cyst walls itself off and just keeps getting larger, destroying bone. But the root canal crowd says they're safe. Enough of the tissue is removed, your body's immune system can get on top of it. There are improved substances to fill the tooth. We can disinfect the tooth better. We can use ultrasonic. And I have a friend who she considers herself biologic, and she's in Los Angeles, and she does biologic root canal. That's like saying military intelligence, jumbo shrimp. There's no such thing as a biologic root canal. I'm sorry. I am sorry to say the most I would do is consider a root canal as a short-term measure to get the patient out of immediate pain if that tooth is, for example, holding up a bridge with 5 teeth in their mouth. But there is no way to completely remove all the dead tissue. There's no way to sterilize a tooth. Tooth is like a sponge. And the materials used to fill the hollowed out tooth leak and cause problems downstream. This is the biggie. Yep. But the American Association of Endodontists says there's no evidence that root canals could be linked to cancer or other inflammatory diseases. That's utter bullshit, okay? Because endotoxins and bacteria in this study alone were present in how many? 90, 99, 100% of the initial samples showed high values of endotoxins still present in the root canal even after 7 days of chemomechanical treatment. This isn't even down the road when it's necrosing and getting really disgusting. Chronic asymptomatic inflammatory lesions around the apex of a tooth with a dead dental pulp, a necrotic dental pulp, can develop unnoticed by the patient and many dentists, asterisk, I put that in, for many years. So this was, anybody see this? Root cause? How many saw this? Hands up. Yeah. It got a class action lawsuit by the American Association of Endodontists. They scared the hell out of Netflix to pull it down, and it got pulled down, and then Amazon followed suit, but you could go on YouTube and find it and blah, 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 probably other types of sites, because there are, guess how many root canals are done in the United States every year? Anybody? Number, quick. Go. 25 million. The average cost of a root canal, people pay an average cost of a root canal is $2,500. How much is 2,500 times 25 million? I can't do that. That's in the gabillion. Okay, that's how much money is on the line. Modern endodontics only started right after World War II. And it was tried as far back as the Mayans and the Egyptians. It does not work. So these are the roots of passive inflammation and infection. This is a histological slide showing the inflammation around the end of a root. This is a tooth that I pulled. Look at that. Root canal tooth wasn't bothering her. How do we find that? Cone beam, CBCT. Yep. And this is one of the most bizarro procedures that were done. Is called an apicoectomy. Anybody have an apicoectomy here? So an apicoectomy is when the root canal is failing, they go in surgically, cut out the part of the tooth that's failing, and then put mercury fillings on the end of it in your bone to seal it off, and then you'll be all better. Then you'll be all better. No. All right. So you got your mercury fillings out, and they put these pretty tooth-colored fillings in. I had a woman in Washington, D.C. come up to me. She had 7 amalgams removed and 7 composites put in. So composite resin has traditionally, up to 5 years ago, been a chemical known as bisphenol A glycidyl methacrylate. It's a plastic chemical resin. And it's BPA, everybody. Yep. They even did a study on 434 children and found that BPA from sealants, dental sealants on the little kids so they don't get a cavity, they all were getting hyperactivity disorders, ADHD, and all of this stuff, all because these are in a warm environment. You grind your teeth. And so people are like, oh, I don't want to use that plastic water bottle in the hot car. But your mouth is 98 degrees. And you grind and you eat and this and that. So everybody squirms when I get through these toxicity things. But the good news is, actually more bad news, I'm sorry. I got to get my slides straight here. Cancer risk. Big cancer. So the woman who had the 7 amalgams out, she had all these composites put in, and it was a biologic dentist, took out the mercury. He put that. She got breast cancer. She had breast cancer. She's like, I can't believe I'm cleaning myself up. And this and that. And I look in her mouth, and I'm like, I just want you to know you have a load of plastic chemicals in your teeth. So lots of crazy. So. At the IOMT meeting 5 years ago, I was a keynote speaker. I introduced this material from Germany. Company is Voco. If you're working with a biologic dentist, make sure they have a BPA-free filling material. We do a lot of ceramic fillings with 3D printing called CEREC. So we do a lot of that. But let's talk about obstructive sleep apnea. This is an epidemic. So, there's 1 in 15 have it. 1 billion people on the planet have obstructive sleep apnea. 75% are undiagnosed. Crazy. This is what it's linked to: depression, anxiety, insomnia, daytime drowsiness, heart attack, stroke, memory loss. They're giving FedEx drivers and UPS drivers have to do a sleep study now. The traditional treatment treats the symptom and not the cause. Forced air down your throat, forced air, open the airway, da-da-da. What happens when you blow up a balloon too many times? It gets flaccid and weak. That's what happens to the airway from long-term CPAP use. So this is an appliance that we use that was developed by an orthopedist that is not a rapid palatal expansion. It opens, and what happens with obstructive sleep apnea, people tend to have a high vaulted palate, narrow arch, tongue tie. We look at tongue tie all the time now. Actually, everyone here, open your mouth as wide as you can, okay? Take your tongue, touch the roof of your mouth without closing. If you closed, you fail. It's like moving when after the music stops. How many here could touch the roof of their mouth without closing? How many couldn't? Honest. There you go. You are at risk of obstructive sleep apnea if you have to close to touch the roof of your mouth. It means that string under your tongue called the lingual frenulum is too tight. And what that does is it artificially, the tongue tie artificially holds your tongue back further in the back of your mouth. And you may not have been breastfed. You may have been bottle fed. That's another risk for obstructive sleep apnea, because when you latch on a mother's breast, it flattens the palate. Bottle feeding, you get this oval and you get a high palate formation. So this is before the treatment. Look at the arch. And that's after. Before, after. We have changed people's lives with this therapy. And this is why I'm excited for Sarge Jr. Yeah, it's radical. My daughter went through this. My daughter Grace did this treatment. And they also the great thing is, especially many of the women in the practice, their smile looks prettier. They don't have that narrow, the space on the side, and their smile looks prettier as well. Children, obstructive sleep apnea, tongue tie, children. I'm concerned about my grandson because he has tongue tie and he has a narrow arch like his father. And it's a root cause of bedwetting and hyperactivity disorder, ADHD. Bedwetting is not a readiness thing. It can be, but most of the time it's not. Most of the time there is a root cause. So this is what we do, and we do it, you could do this from home. We do a Zoom call. We look at a CBCT, which you can get taken locally, and then we read it, and then we send you this WatchPat 1, which is a disposable sleep study. He has a little thing on his chest. He has a thing on his finger and a little Swatch wristwatch. It's disposable. We send that to you, and in one day, we get an 8-page respiratory report that gets read by a respiratory therapist. And then you meet Dr. Dean Rayo in our office, who is the leading authority and the national advisor on airway health to biologic dentists across the country. So that can all be done without stepping foot in the office. Let's talk about TMJ. TMJ is inflammatory. But guess what? Obstructive sleep apnea causes TMJ. You fix the obstructive sleep apnea, TMJ goes away. But there's something called TMJ. Actually, we see a lot of TMJ with cavitations and Lyme spirochetes. Lyme, and Christine, and Dietrich talked about this all the time, that basically if you have mandibular cavitations, and you have Lyme disease, they love hanging out in there. And you get backache, neck ache, tightness, TMJ, all of that. Root cause, Lyme. Breaking a tooth could be a sign. These are 7 signs. 7 signs of 7 deadly sins for occlusal disease. So we know there's a bidirectional thing between the spine. How many any chiropractors here? Osteopaths, I know a few. Okay. Huge connection between occlusal disease and spinal posture. TMJ is directly related to cervical and scapular region by an interrelated neuromuscular system. Let's talk about my favorite. Okay. Why is there a poison warning on toothpaste? 1988, Procter & Gamble launched Crest with Floristan or whatever, and they made it bubblegum flavored and fluorescent blue with sparkles. Crest Sparkle. Fluoride fatalities in children went up 280%. There's enough fluoride, and this, I cringe just looking at this photo. It's not my photo. I got it off the internet. There's enough fluoride in this tube of toothpaste to be fatal to 2 children under 5. And we have kids sticking it in their mouth. So now we have this warning: keep out of reach of children under 6. Wait a minute, they're brushing with it. If more than used for brushing is accidentally swallowed, get medical help or contact Poison Control Center right away. Do you ever read that? How many ever read that on the back of a toothpaste tube? Do you ever wonder why it's there? Yep. And that's toothpaste. That's where we've been. Fluoride, I could spend 3 hours talking about fluoride and the failed fluoride experiment of the last 75 years. Probably one of the worst public health experiments ever. Lower IQ in children, over 60 global studies on drinking fluoridated water lowers IQ in children. 60. Decrease in bone density and strength. So we could go on and on and on about fluoride. I think it's time to end it. I think it will be ended. The idea of dumping that you have to wear hazmat suits to dump hydrofluorosilicic acid into the water supply. It's criminal. It's criminal, but there's so many things that are criminal. I'm losing count. You know, it's like just stay right. I mean, I can't keep up. I just have to ascend. We have to stay in a state of love and gratitude and ascend. That's where we need to be. But we need to be wise stewards, and we need to respect this temple of the body, and that's why I'm up here talking to you. But our consciousness, we need to raise consciousness. So, yep, I told you about this. Colgate Total, #1 toothpaste in America, triclosan. Triclosan was bad. This was in People magazine, and I was in Ravello, Italy, laying by the pool, reading a People magazine, and this page came out, and I got up and started pacing around the pool, and my wife's like, "What's the matter? Relax. Just relax. We're on vacation." No, because they're putting eliminates 15 times more bacteria to improve the health of the mouth. They already know that killing bacteria is not only ineffective but harmful. And they get away with putting an ad like this to reinforce a failed science, an old, archaic, failed science that you got to kill plaque, you got to kill bacteria. So you look at that and subconsciously you're thinking you got to kill. Kill, 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 kill. And then this one, yeah. I talked to you a little bit about this. This one really drives me crazy because this is the process of making xylitol. By the way, this came out of an organic chemistry textbook. This is an organic chemistry textbook. Can you read these words? Hydrogenation. You ever think of margarine? Okay. Hydrolysis. Okay. Separations. What's it called? What do they call it? High value chemical. That's the sugar alternative. Now, I put whole leaf non-GMO stevia in Revitin, and Revitin is a mission for me. I've been on the research of this 20 years. And the only reason why it's there, I have not made a dime off of it. All I do is put more money in. That's why my son's here. and Deborah Hader's here because they said, please let us help you. And I want everyone here to use it. And the reason it's not peppermint is because peppermint is antimicrobial, along with Tulsi oil, along with, oh, by the way, xylitol can kill your dog. All right? With you, it just gives terrible intestinal diarrhea and gas. But in your mouth, it strips, it kills. Those were the studies from Finland that were paid for by Daneska, the subsidiary of DuPont in Europe, did studies in Finland to show that xylitol killed Streptococcus mutans bacteria. What does that remind you of? Oh, yeah, we got to kill. Strep mutans lives in the mouth, and it's benign and even beneficial when you're in a balanced, stable environment. So, here's a natural toothpaste from an old friend of mine, Dr. Mercola, Joe Mercola, and he came out with this toothpaste a while ago, and I will give Joe a lot of credit because he took this product off the market after I pointed this out to him. He took it down. He does not sell this. This product is gone. Fluoride free. That's what he had, and no SLS. Sodium lauryl sulfate is what makes toothpaste foam up, okay? But it is very, very disturbing. Can denature DNA of the gum tissue. It's really bad for you. So SLS causes canker sores in your mouth. So canker sore formula is SLS free. So we've never had SLS. We use a cactus extract that helps the product act more like toothpaste. But anyway, this is what Joe had in this thing here. Tulsi oil, xylitol, licorice oil. This is the worst one. This is a really volatile terpene that is, you get it in your eyes, you're going to burn your eyes out with tea tree oil. And there was a company, Desert Essence, that had a product. But this is what was in this. So, this has been, and believe me, this is beyond me. The inspiration for this, I was getting downloads to do this, especially putting D3 and K2, vitamin C, D, C, E, ionic minerals, CoQ10. So the first study we did, so this is what we do. Balance of the oral ecology, no poison warning, keeps mouth clean and longer, safe to swallow, safe to swallow. My grandson, who just turned 5 last week, he was basically brushing from 5 months old. He loves it. He sucks it off the toothbrush. And Wolfgang Haas came up to me at a meeting, I think a BRMI meeting in Kentucky, in Louisville. Wolfgang Haas, who was with the Paracelsus Clinic, worked with Thomas. A lot of you know who he is. He came up to me and said, the best toothpaste I ever tested, the best was, Grant doesn't like me doing the German accent, was that? The best one was Weleda. Anybody hear of Weleda? Good company, clean products. Weleda makes an herbal product that's pretty good. Doesn't do any harm. Let's just put it that way. Doesn't do harm. It's not a, it's not a microbiome design product, but they had the right idea. So he tested it and he said it had 7,000. I forget what the units are. Angstrom, whatever. It was a bioresonance testing that he did. And Weleda tested at 7,000. He goes, that's the best, that's the best. But if you want, I will test the product. I will test the product. And he took the product. He sent me an email from Switzerland 3 weeks later. And the first word was, congratulations. I tested your product, and it resonated at 25,000. 25,000. So we have a double-blind, randomized clinical study going on right now, 50 patients. And we're excited about it because we're measuring the biodiversity of the microbiome. The more diverse and robust, the more we create organic gardening in your mouth, the more we create organic gardening in your gut, the healthier you will be as a human being. So this was the first study, and it was a very primitive study. We had 7 days. We got a greater reduction in inflammation than Colgate did at 12 weeks, and their studies were done in the Philippines, so God knows. 12 weeks, they got 22%. We were at 26% reduction in 7 days. So then we did the second study in Italy at Catholic University in Rome with these great young doctor researchers. And it was a 10-patient study, and we were going through tons of product. We kept sending more Revitin over. So finally, I flew over, and I met with Nicola Grandi, Giuseppe Platino, and Andrea Butti, and I sat with them, and they were like, this product is so good. I have to do the accents because it gets more in the flavor. This product, this is so good. I love it. And I said, guys, why are the patients going through so much product? And he said, oh, they look at each other and they start laughing. Classic Italian, Moira. They're like, oh, I took it home to my mother. I gave it to my girlfriend. I gave it to this. They were like taking it home. Anyway, this is 14 days over the control, which was Crest Pro Health. We had a 42% reduction in gingival inflammation, 46% reduction in plaque, 72.5% reduction in bleeding. Your gums stop bleeding in 2 days. You rub this on your gums. So this is by far, and I've been at this a long time. These studies go back to 2008, 2012. I mean, I've been at this a long time, and this is a photograph just 4 days before. Now, look at the inflammation here of the gum. 4 days, just changing what they were brushing their mouth is. Your mouth wants to self-regulate and heal. You just need to respect the science. That's all Revitin does. And this was a guy, this is the last story I'll say. He was at a functional medicine meeting that I was doing in Utah. Came up to me, he was supposed to have gum disease. He was supposed to have gum surgery. The black is all bleeding marks. And the pockets, you know about gum pockets? 5 millimeters, 7 millimeters, I gave him 3 tubes of Revitin. It's a tube a month. 3 tubes. He came back. And I was speaking in Atlanta at the IAOMT meeting in Atlanta, Georgia, and he went running up to me, and he was holding these 2 pages. And he said in 3 months, not only did he not need gum disease, it almost completely stopped bleeding his whole mouth without having any gum surgery. And he was like just super ecstatic. And the reality is that, there wasn't anything really special other than changing and respecting the science. So I'm going to just finish because I'm going on. I'm a little long-winded. Please follow me. Cavities. So, do you think you need fluoride? You know what we know? Do you know what we know about cavities? A healthy microbiome. This ecology of your mouth. There's something called the dental cyalomicrobial complex, and I should have had a picture of it. Because saliva in a healthy mouth with a balanced microbiome transports ionic minerals from saliva. And watch out for this nanoparticle stuff. Nanoparticles can penetrate the cell membranes and the nucleus of the cell and damage mitochondria and do DNA damage. Nanoparticles, just because they sound cool, doesn't mean they're good for you. So this nanoparticle hydroxyapatite is not good. The way you heal cavities, how do your cavities heal? You can heal cavities if they're in enamel. Once they passed into the organic layer of the tooth, I have not seen many cavities reverse, but I've seen the progress stop. But you can reverse decay when it's called incipient decay, it's in the inorganic part, which is the enamel. So the way your teeth heal, and this was the biggest aha moment, because when I was in dental school, it was bacteria cause cavities, bacteria cause gum disease, bacteria are the problem. The oral microbiome is an intelligent semi-permeable membrane that transports ionic minerals from saliva to the surfaces of your teeth. It transports oxygen, molecular oxygen to your gums. And it takes what? Ionic oxygen and free radicals away. The bacteria heal your teeth and feed your gums. That was a mind blower for me because it was opposite to everything I thought I had learned. So thank you for that question. Yes?
Any difference between birch xylitol and corncob xylitol?
Excellent question. No. They try to make it sound good. Oh, we get it from pretty birch bark. It's still a high-value chemical. It's still extremely disturbing. It is not absorbed or metabolized by the human body. But you know what's worse than xylitol? Erythritol. Erythritol. You know, it has, oh, by the way, they love to put it with that other chemical. What's it called? What is it? Monk fruit. Monk fruit. Read the monk fruit label. They throw erythritol with monk fruit. And erythritol is absorbed but not metabolized. And it stays in your body for a long time, and it's been linked. Studies have shown erythritol being linked to not only GERD, but esophageal cancer. Yes.
Dr. Jerry, you may be doing this, but have you heard of some of these biological dentists who are able to save a tooth from a root canal?
Yes. Yes.
So I don't butcher how it's done, but so how can we clean out the tooth?
I use ozone, and I use a laser. So I do what's called a pulp cap with a laser. So we actually kind of like seal off the disease part, okay? And we use ozone a lot. That's a perfect place for ozone. Yeah, so that's what we're doing. We're avoiding the root canal, because once you get it to the undertaker and they embalm the tooth. You know, they used to use formaldehyde after World War II. They used to use formaldehyde in teeth. It was called Sargenti paste. Do you remember, Dick? And people were getting really sick, so now we got better. Okay. My son is trying to get me off the stage hook. Yeah, Justin.
If someone would chew gum, what would it be?
What's it?
If someone would chew gum,
yeah.
what would it be? What would
Oh, that's a good question. If you chew gum, what would it be? Well, it's a dilemma. You know why? Because the gum that tastes good is either loaded with sugar or it's loaded with chemicals. It's loaded with xylitol, a lot of xylitol gum out there.